A 71-year-old patient, Robert, sat in my exam room looking uncomfortable. Not physically uncomfortable, emotionally. He finally said, "Dr. Kayla, I've been doing something the same way since I was 20, but now it doesn't feel right anymore. And I'm scared something's broken." Nothing was broken, but 50 years of the same habit had been quietly damaging his prostate health, his nerve sensitivity, his vascular function, and he had no clue it was happening. The habit, his masturbation technique. The damage, preventable, fixable, but only if we talk about it. I'm Dr. Kayla, board-certified urologist with over 10 years of experience, helping men past 50 maintain their vitality, their function, their dignity. No judgment, no prescriptions, just honest guidance. You've heard masturbation is good for you, and yes, it can be. But after 60, the way you do it matters more than whether you do it. Small technical mistakes, wrong timing, excessive force, quietly undermine your prostate, your circulation, and your sexual health. Today, I'm revealing 7 masturbation mistakes that silently harm older men, and the exact corrections to make before permanent damage sets in. Mistake number 6 is the one that surprises every man I tell it to. Before we begin, make sure you subscribe to my channel, Dr. Kayla Health Tips, hit the bell icon, and comment below where you're watching from. I love connecting with men worldwide who refuse to accept decline as inevitable. Now, mistake number 1, and it's not what you think. Mistake number 1, using pornography as your primary stimulation source. Countless men past 60 tell me the same thing. Nothing excites me anymore. Is that just aging? And I always answer the same way. No. That's overstimulation. Here's what happens biologically. Your dopamine system, the system responsible for pleasure, slows down after 60. It needs longer recovery time between stimulation cycles. But modern pornography delivers constant, rapid-fire novelty. Your brain becomes overwhelmed and protects itself by numbing pleasure receptors. The result? Real touch feels dull. Intimacy feels boring. You need increasingly extreme content just to feel something, until even that stops working. Emotionally, you feel disconnected from yourself, from your partner, from pleasure itself. The fix: 14 days no screens. Relearn arousal through sensation alone. Touch, breath, presence. Your dopamine system will reset, and natural pleasure will return. Now let's talk about where many men choose to do this, and why that location causes real harm. Mistake number 2, masturbating while sitting on the toilet. I understand why. Privacy, a locked door, no interruptions. Practically, it makes sense. Anatomically, it's a problem. When you sit hunched forward on a hard surface for extended periods, you compress the blood vessels feeding your pelvic region. After 60, circulation there becomes critical. It supports prostate health, erectile function, bladder control, everything. That's sitting. Position restricts blood flow, exactly when you're stimulating the area. Over months and years, this leads to chronic pelvic tension, weak urinary stream, difficulty with arousal, and unexplained groin discomfort. The solution is simple: stand, recline, or lie down, any position that doesn't compress your pelvis. Give your body the circulation it needs. Which brings us to mistake number 3. Mistake number 3, rushing through the experience. Most men treat this like a chore. Get in, get done, move on. But rushing activates stress hormones. Your heart rate spikes. blood vessels constrict. You trigger fight or flight instead of relaxation. No oxytocin releases. No deep satisfaction registers. You may climax, but your nervous system doesn't heal. You feel depleted instead of renewed. Over time, rushing rewires your brain to see pleasure as something to endure, not enjoy. Sensation dulls. Connection disappears. Slow down. Treat this as restoration, not obligation. Your aging nervous system responds to gentle, sustained stimulation. Give it time. Now here's something most men never consider. Mistake number 4, ignoring the pelvic floor muscles. These muscles support your bladder, prostate, and sexual organs. They control erection quality, ejaculation control, and urinary flow. Many men never engage them. Or worse, they push downward, weakening them over time. The result? Weak erections, leakage, reduced sensation. The fix is powerful and simple. During arousal, gently contract the muscles you'd use to stop urination. Hold for 3 to 5 seconds. Release. Repeat. This strengthens nerve activation, improves blood flow, and restores control. I see this work constantly. Which leads us to the question every man wonders. Mistake number 5. Getting frequency completely wrong. Too often irritates the prostate and drains energy. Too rarely stagnates circulation and dulls sensation. From years of clinical experience, 1 to 2 times per week works best for most men over 60. Intentional, mindful, not mechanical. But even with perfect frequency, this next mistake can undo everything. Mistake number 6. Applying too much pressure or force. As sensitivity declines, men grip harder or use rougher pressure. This damages delicate penile nerves, causes microtrauma, scar tissue, and loss of elasticity. Some men even develop curvature. Pleasure becomes something you force instead of receive. That blocks blood flow and hormones needed for satisfaction. The answer is gentleness. Always. Now the final mistake, and perhaps the most important. Mistake number 7. Masturbating without emotional connection or intention. When emotion disappears, so does healing. Oxytocin doesn't release. Dopamine doesn't restore motivation. You finish feeling empty. That emptiness isn't aging. It's absence of presence, gratitude, intention. Even solo pleasure can be sacred. When you bring awareness back, your entire system responds differently. Let me summarize the roadmap. Step away from screens. Change your location. Slow your pace. Engage the pelvic floor. Maintain healthy frequency. Use gentle touch. Bring presence and intention. You are not broken. Your body is asking for a different approach. If this helped you, like this video, share it, and subscribe to my channel. Dr. Kayla, Health Tips for Weekly Medical